therapist. Thank you for joining me at home. Today we're just going to have a video on different exercises you can easily perform on your bed. The first exercise we're going to go over is a hip flexor stretch at the head or the base of the bed. All you have to do is come up against your bed, grab one leg, ideally your thigh, and then you just roll onto your back. So in this stretch, what you're trying to focus on is the leg that's hanging off the bed. You should feel a stretch there in the front, and you don't want any back pain. So if you have back pain, you might have to pull that knee up into your chest a little bit more. Then to switch, you can take that opposite leg up into your chest and let that other leg hang down. Ideally hold for about 30 seconds and repeat about 3 times. When you're finished, you can take both knees up to the chest and then roll yourself back up. Now, if that's a little too difficult for you, you can also perform it on the side of your bed. To get into bed without having any back pain, you could do that log roll technique. So that log roll, lay on your side first, and then you just roll, knees and shoulders go together, and then you're on your back. Knees are bent, feet are flat. One leg off and bring the other one up into your chest. So this way, it's not as much of a stretch. If you need a deeper stretch, you can scoot a little bit closer to the edge. Try to keep your hip close to the edge, but not your shoulders. But try to maintain a neutral spine position. One knee up to the chest, the other one comes off the bed. And then you should feel, once again, that stretch in the front side. Make sure you don't have any back pain with this stretch. Hold about 3 for 30 seconds and come up in between and just rest in between. Then you pull knee up, bring the leg down, hold for a good 30 seconds, and then you'll repeat. If you want to do the other side, you'll need to roll to your side first, come on up, and then you have to roll to the other side. And that is your hip flexor stretch. Some other stretches you could do in bed. First thing in the morning, you might be feeling a little stiff. In the middle of your bed, wherever you're at, and just have your arms out, and then you can just rock your knees side to side. So this is that lower trunk rotation, and it's just kind of waking everything up, loosening up the hips and the back. And these exercises for the general population, they're not specifically for any certain injury or diagnosis. If you have any questions or comments, you can always comment below, or you could ask your physical therapist if you're not one of my patients. Then you can also do your knee to chest stretch. Bring one knee up. You can keep the other knee bent or straight, whatever is a good stretch for you. Remember, when you're stretching, you don't want to stretch to pain. You just want to feel that gentle stretch and hold for a good 30 seconds. Then you can bring the other leg up and switch legs. So this one's called the single knee to chest stretch. You can also take both legs up and pull both knees into your chest, and that is the double knee to chest stretch. So double knee to chest stretch, 3 for 30 seconds. Single knee to chest stretch, 3 for 30 seconds. And those lower trunk rotations. All very easy to do in the morning just to kind of loosen everything up. And those are some good stretches that you can do in bed. Stay tuned for the next episode. We'll go over a couple strengthening exercises you can do in bed. Thank you.